everybody, I'm Dr. Suhasini, practicing ENT surgeon in Bangalore, and I'm here to talk about vertigo. What is vertigo? It is a sudden spinning sensation which is triggered by motion. And why is it so feared? Is the fear really justified, or is it because we do not have enough knowledge as to how this can be handled? So there are different types of vertigo. It's either of peripheral or central origin. Peripheral is the one which is usually caused by the inner ear system, which is the one which gives balance to our body. And otherwise of central origin, that is caused by the cerebellum, that's of the brain origin. Amongst this, BPPV, that's benign paroxysmal positional vertigo, is the most common form of diagnosis that can be caused. And just as the name suggests, it's very benign and it's not really harmful. However, sometimes along with this vertigo, if there are certain other symptoms which is tagging along with it, then we will have to be really cautious about it. And what are these red flag signs that we will have to be very cautious about? Either if a patient has anorexia or loss of appetite, slurred speech, vomiting, severe pain in the ears, or tilting towards one side while walking or standing, and sudden jerky movements or abnormal eye movements. Any of these symptoms which are there along with vertigo, then I do really suggest that you need to visit your doctor immediately. Life with vertigo is hard, but here is how you can manage it. How are you going to manage if you were to be in public or at home, or if you were to be alone, or if most dangerous of all, if you were to be while in the middle of driving or in the middle of a physical activity? Here are a few tips that how you could help yourself. During an attack of vertigo, first suggestion is to lie still and lay down in a dark, quiet room. This would help lessen the trigger of the vertigo. Do not bend over, instead squat yourself to fetch anything if you were to be taking anything from the floor. Do not stretch yourself much, do not stretch the neck much to reach over a top shelf. If you were to be advised to use a walking stick, please do really use a walking stick. If you will have to be walking, please do take the help of a wall, or otherwise, as mentioned earlier, a walking stick would be helpful. Do not move very quickly or rapidly, because these are the other few things which would really trigger vertigo. And last of all, try to relax, because anxiety is one of the worst factors which could actually trigger vertigo again. And if along with these symptoms, if you were to be having any of the symptoms like hearing loss or facial numbness or facial weakness, I would suggest again if you should contact your doctor immediately. A lot of people keep asking me if vertigo and migraine have a connection, if they do occur together. Well, here's my answer to it. If at all people do experience dizziness or balance disorder along with headache, then they can occur together. So they can be either independent to each other or can be related to each other. And if at all a migraine sometimes can manifest as a symptom in a vestibular condition, and this is known as vestibular migraine. So what exactly is vestibular migraine? Vestibular migraine is a type of migraine where a person experiences vertigo symptoms along with migraine symptoms, that is headache, nausea, vomiting, sensitivity to light and sound. Also, these symptoms can actually occur with or without an actual headache. People with vestibular migraine can decrease the number and the intensity of the episodes by taking prescribed medications regularly, exercising regularly, managing stress, following right sleep and meal schedule, and avoiding trigger factors. And after doing all of this, and if at all there is anybody who experiences vertigo with migraine together, I would suggest and recommend them to see their doctor immediately. Did you know more than 1/3 of the seniors over the age of 65 fall each year? Broken bones not only lead to a loss of independence, but data also shows that falling is the leading cause of injury-related death in seniors. So older people do not really have to live in the fear of falling. By recognizing and treating vertigo early on, we can prevent our seniors from falls. Do you know any elderly people back at home who have been frequently having vertigo? Here is a handy guide that should serve your goal. Remove clutter, keep the floors clean, install grab bars in the bathrooms, and install railings on both sides of the stairs. Use non-slip bath mats in the bathrooms and also other slippery floors at home. Use higher wattage bulbs and night lights to see. Improve balance and regular exercises. If at all they become lightheaded or dizzy, make them lie down immediately. If they have been prescribed a walker, be sure to use it. This Balance Awareness Initiative, let's stand for balance and create as much awareness about balance disorders as we can. Thank you.